Well, good morning, everyone. As you all settle in, we know this is going to be a very large group. Welcome to the Remote Interpreter webinar series. We are really excited to be hosting, as Cross-Cultural Communications, the third webinar in this series about how to be a remote interpreter and information about the whole field and profession of remote interpreting. This is even more exciting for us because in the last one, we had attendees from 36 countries and 41 US states, and the numbers are very, very high. So there's a lot of exciting participation. This is the webinar that in the series that is devoted to interpreting etiquette and protocols. And these are protocols and etiquette related to over the phone interpreting, OPI, video remote interpreting, DRI, and although RSI will be mentioned, the presenters will not be discussing it in any detail. Cross-cultural communications, for those of you who do not know, we are the ones hosting this webinar series. We are the only US national training agency for community and medical interpreting. We're also the only publisher in the country dedicated to interpreting textbooks, training manuals, and workbooks. I am Marjorie Bancroft, your host for today, and also the director and founder of CCC, as we call Cross-Cultural Communications. I am absolutely thrilled to present our two presenters to you. First, just a couple of points of etiquette, and then I will be introducing Tatiana and Sarah with pleasure. First of all, you have chat feature, as you know. If there's a default that if you don't change, you will be sending your chat comments to the panelists. If you want to send your chat comments to everyone in the group, then you would change that default setting. Please use chat for all your general comments or questions to CCC or questions about CUs and certificates. And for Q&A, which you will find at the bottom of the middle of your screen, it's very near the chat. If you could please reserve that for questions to the panelists. You will have about 45 minutes of presentation, and during the question and answer period, I will be coming back to actually ask the question, at least as many questions as we have time for, to our two wonderful presenters. If you have questions about certificates, please understand that this time, especially for those of you who have attended the previous two, we have somewhat automated our process. You can look for an email in about 24 hours after the webinar. If you want a certificate, there will be a link to the certificate for download, and the CUs for CCHI and ATA will be mentioned on those certificates. We were taking emailed requests before, but the procedure has changed to simplify it because we're getting hundreds of requests. So hopefully that information will be repeated periodically in the chat feature as people join us. Without any further ado, I want to present Tatiana Sestari and Sarah Stockler-Rex, both of Marty. I have had the pleasure of getting to know them extremely well because they are two of our authors, as they will be mentioning, for the upcoming, the Remote Interpreter textbook, which we need now more than we ever imagined that we would be needing it. And in addition, they work for Marty, which is an extremely reputable language company, very established in the States. They will be introducing themselves. These are veterans of the field, despite their youthful appearance. They come with extraordinary backgrounds, as you will be hearing. I am ever so excited to be having them as your presenters. I will now cede my host position to let them have their precious time with you. We look forward to your chat and questions. We'll see you again shortly. Bye-bye.
All right, thank you everyone for joining today. As Marjorie mentioned, this webinar is part of a series. So this is the third webinar in a 4-webinar series. Today we'll talk about basic protocols and professional etiquette in remote interpreting in VRI and OPI specifically. And next week, tune in for the final webinar in the series with guidelines for remote healthcare interpreters. That one will be presented with Tati as well, and our other author, Danielle Meter from ULG. All right, so let's get right into it. Like we said, we're talking about professional etiquette in video remote and over the phone interpreting today. So Tati can give us a little bit of background on how all of this came together and why we're doing this webinar.
Yes, as both Marjorie and Sarah said, well, first of all, thank you for being here. I haven't even said hi. I'm Tatiana Sestari. So I'm one of the team members in this wonderful group of authors of the Remote Interpreter book. So this is coming soon, hopefully this year. No, it will be this year. And it's a collaboration of many companies that got united and in an effort to provide appropriate training for remote interpreters and tools such as this book. So we have proudly been announcing this book during this series of webinars, and the authors, which you see listed here, are working hard on the book, but consider it was important to provide you with some of the material that will be in the textbook in a webinar form, okay? So a little bit about us. My name is Tatiana Sestari. I am a pharmacist and a pharmacologist with a national certification in healthcare interpreting. I've had about 8 years of experience as an interpreter, and my experience in interpreting has been mostly via video and phone in consecutive mode. I've been a trainer, educator, and mentor to interpreters in healthcare and healthcare professionals as well. Um, you know, teaching in several universities. I previously served as the Interpreter Education and Compliance Manager at Marty. That was for approximately 5 years. And in my current role as Director of Language Service Advocacy, I help pretty much bring best practices in language access to hospitals and remote interpreters across the United States. I'm very humbled and honored to be part of this writing team and, of course, to be here with all of you today.
Yes, I would have to echo those sentiments. So a little bit about myself as well. My name again, Sarah Stockler Rex. My background, my BA is in Spanish and linguistics, and I'm currently pursuing my master's in applied linguistics. I hold my national certification in healthcare interpreting, and I've been interpreting for nearly 9 years now as a Spanish interpreter, starting out face-to-face, then moving to video remote. I currently serve as the manager of quality assurance at Marty, and I've monitored, mentored, and trained interpreters since joining the QA team in 2016.
All right. So before we start talking about protocols and professional etiquette in remote interpreting, due to time limitations, we are assuming that you have been fully trained in basic aspects of interpreting and that you have some experience in non-remote interpreting, or maybe you have had some experience in remote interpreting already, and that's okay. We just want to make sure all of you who are listening to us right now understand that we cannot cover everything during this time, okay? All right, so we have our first question, and please follow Marjorie's instructions and tell us what you think is different in remote interpreting regarding protocols and etiquette. So we want to see some of your answers. Tell us what you think is different in remote interpreting regarding protocols and etiquette. All right, we see some answers.
Seeing some answers that there's no difference, same as in person, use of technology, background noise. See, introduction requires a savvy use of technology, missing nonverbal cues. Okay. And there's so many people here, the answers are flying in. But it seems like some themes are technology and possibly that there are no differences, that they're very similar at least.
Okay, well, we're gonna go over many of these, and yes, some of the answers you have given us are correct, okay? But we're gonna go over some of these and discuss them during the webinar.
So regarding the modes of interpretation, it is possible to do both consecutive and simultaneous in remote interpreting. However, the modes you're able to use will depend on your technology. So namely the platform you're using will determine this. So this is important to know ahead of time. So if you're used to working in face-to-face and being able to switch to simultaneous, and now you're on a platform where you can only do consecutive, you need to think through some scenarios and how you might have to handle them differently. So here's an example. Think about the fact that you can only use consecutive mode. You can't switch to simultaneous. Your platform doesn't allow that. What would you do if you're interpreting for a parent-teacher conference where the mother and father, who are divorced, are both present? Mother and father start arguing about how to address some of the teacher's concerns with their child, and they ignore your attempts to ask them to take turns speaking. So let's see if we have any answers for these. Pause sign, okay. Now remember, we can't switch to simultaneous. This is on a platform, we're assuming that we cannot switch to simultaneous. Can mute them, okay. Well, that's an interesting point. So in this scenario, mother and father are both in the same location. So if you're muting them, if you have that capability, you're muting all participants. Set the ground rules at the outset. Yes, I like that. Raise your hand, ask for pause. Use summary if they won't stop. Okay, we have some good answers here. So although we are saying, they're ignoring your attempts to ask them to take turns, it is important to take that as a first step to remind them to speak one at a time and remind them of the reason for that. So remind them that, as the interpreter, I need you to speak one at a time so I may interpret accurately, right? Reminding them of that reason is helpful. Be firm and assertive while still professional. You may need to interrupt them and just start interpreting and kind of manage the flow that way. Very last resort, as someone mentioned in the chat, summarize. And we'll talk more on turn taking later on in the presentation.
All right, so interpreting, like all professions, requires those who practice it to always be learning ways to enhance the skills needed, as well as following certain protocols to meet goals efficiently and safely. So this webinar, as we said before, will focus on protocols, which are different from skills. So let's define these two terms and apply them to a different field. So a protocol, as it says here, is defined as an accepted or established way of doing things. So in soccer, there are many protocols or rules that we need to follow. So you see some of those in here. It's just certain protocols that, we have to know, okay? Now regarding interpreting, well, we have guidelines to introduce ourselves. We have protocols on how to position ourselves, to request clarification, to mediate, and many others, right? These are defined typically by professional organizations or the companies we work for, okay, or we work with. So in this context, a skill, which is the other side of that, refers to an ability or expertise. So you may know all the rules in soccer, but if you don't develop the ability to control where the ball is going or kick it the right way in the right direction, you will not be able to perform well. So in interpreting, for example, we have to develop skills such as message transfer, memory, how to problem solve, assertiveness, all that. So also, if you have great skills, but you don't follow the protocols, you may be out. Okay, so that's, you have to make sure you work on both and you learn both. All right, so we will be briefly touching on these protocols that we're showing right now as they apply to remote interpreting. So positioning, professional introduction, direct speech and indirect speech, turn taking, intervening, and hold time. All right, so let's start with positioning. I think we all agree that positioning in face-to-face interactions may affect the flow of the session. Well, believe it or not, positioning of some components in a remote interpreting session is important as well. So for users and interpreters who would be signing, using any type of sign language, they should be in front of the camera, with nothing blocking the camera. So as you see here, for example, in this little window, you see the patient. So you see not only the face, but also the signing space of that patient, which is this whole area, okay? And here you see an interpreter. And in this case, we're capturing the signing space of the sign language interpreter. The device must be in front of the end user. In this case, I mean end user, the patient, pointing at their signing space as said before, and in an area in the room with the best internet connection. This is typically missed when we don't know about these things. It's important to be in an area in the room, whether it's a hospital room or a school room or a courtroom, that has the best internet connection and facing away from bright light or windows. Otherwise, you'll only see silhouettes, okay? Regarding the interpreter, as I said before, must be in front of the camera and facing the camera, center in the view field and including the whole signing space, and always, always close to the microphone and speakers, okay? Now, for sessions that involve spoken language interpreters in video remote interpreting, it's very useful if users are in camera view. It's not as strict as with users that sign, but it's very important to have the users in camera view or very close to the interpreting device. Again, in an area where they have the best internet connection and away from bright light and windows. The interpreter must be in front of the camera, facing the camera, and centered in view field as well, okay? For over the phone interpreting, the most important part is to be close to the microphone and the speakers, but not too close that you would cause some feedback or noise feedback, or that others can hear your breathing. So I'm gonna show you how that could happen. If this is my microphone. If I get my microphone closer to my mouth or my nose, you may hear my breathing. Okay, so we want to avoid that. That's why we want to have a good microphone and speakers or a headset that has both, but we don't want the microphone too close to your mouth or nose, otherwise you're going to hear breathing and you may be causing some noise feedback. So, I was thinking about all this, and you may be wondering why we're telling you all this, how to position the device or how to position the users when you may not be the one making those adjustments. In this case, typically the user that's making those adjustments. Well, you as the professional facilitating communication may have to request that some adjustments are made before the interpretation starts. And that's why we're talking to you about these things. So based on what I mentioned in the previous slides, you can request users to position themselves and the units appropriately, okay? So know that, you know, these are some of the requests you can make. You know, not only positioning the users close to the device, maybe they have to position themselves close to a speakerphone if they are using one. Again, finding the best area of internet connection, camera facing all the users, and if it's a user who signs, specifically in front of that end user. In this case, end user, I mean, when I say end user, I mean a patient, a mother, a student, you name it, okay? And what other thing that you could request if you're in video is that they show you some of the tools that they're using to explain individuals in the session. For example, you know, if they're doing physical therapy exercises to show how to do it, that will help you with the interpretation. Or if they're using any illustrations to explain a point, you can also request that they're able to show you those illustrations. Now, it is very important to understand and to know that sometimes it's not possible to accommodate our requests, okay? And an example of that is during emergencies. If you have many, you know, if they just start, the call starts and they tell you this is an emergency, we have patient so-and-so, we need you to interpret, you go right ahead and start interpreting, okay? There are other cases as well where we don't really ask for many other positioning requests, but that is definitely one of the most important ones. All right, so another protocol in professional is professional introduction. So this is something that varies per specialty in remote interpreting, and based on our sources, and of course there might be some exceptions, professional introductions are commonly used in educational interpreting. So that's what I have up here. May or may not be used in business interpreting. It depends on the business, the type of business, okay? It may not happen in legal interpreting, but what I mean is that there's not an official protocol for a professional introduction as we have developed one for community interpreting, but there are definite protocols for how to interpret, how the interpreter should speak, including any introduction, which is to address the judge and the official first. You know, there are certain variations to these. It doesn't really, or it doesn't typically happen in conference interpreting as I have here, may or may not apply. But oftentimes the speakers in a conference may acknowledge the interpreters, and then you as the interpreter end up interpreting your own introduction, okay? And regarding healthcare interpreting, professional introduction has become very important. Basically, this is the only chance you have to gather information. So, you know, use that time to make sure you know a little bit, if possible, of course, if this is not an emergency, that will give you a little bit of time to know what's coming next, or you know what kind of vocabulary you have to organize in your mind already. Okay, now don't push it, as I said before, if this is a real emergency. Very, very important during the introduction and also during the remaining of the session, never assume that you see all the people in the room, okay? I have had many surprises as a video remote interpreter thinking that I have, let's say, a patient and a doctor or a mom and a teacher in front of me, and all of a sudden there's a third or a fourth or a fifth voice behind the camera, and I had no idea they were there, okay? So be careful with that. And very important, extremely important, in healthcare, never read patients' information to the same provider you had earlier because they may be with a different patient. For example, don't say things like, is this patient Julie's shoe? Or nurse, are you still with patient Tulaya, medical record number, blah, 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 blah. Please, please don't repeat any information to the providers. And because you might be breaking some laws, you may get in trouble, okay? Now, professional introductions may vary, okay? Here we have an example of a professional introduction with briefing, what we call briefing. And it's very similar to the one our colleague Caroline showed us last week. It has the name of the interpreter ID number, and the language pair of this interpreter. But we added certain other components that we can, vary depending on the situation. Some of the things we added here is, I'll be interpreting everything that is said. Please speak to each other and not to me, not to the interpreter. Speaking in a loud and clear tone, pausing often. Everything will remain confidential. This is very important for some of the parties, not necessarily all. And before, if you have a chance when you introduce yourself to the person who placed the call, if there's enough time, as I said before, you can say things like, is there anything I should know before we begin? At that point, they can tell you, oh, this is just a parent-teacher conference, or we're only going to be addressing A, B, C, and D, or mom is in labor and delivery. We need to start now. She's about to start pushing, so that you kind of get a picture, a sense of what's coming, okay? If time permits, if you have even more time, because you can say this in few seconds, you can also ask who all is participating in the session today and what are their roles, okay? Many times you see 3 or 4 individuals in front of the camera. You may want to know why they're there. And if there are, multiple participants present, ask them to remember to speak one at a time, allowing time for interpretation. If this is a platform of consecutive interpreting. And if you're aware that this session involves some users who speak the same language, for example, an English-speaking student, English-speaking teacher, and an Arabic-speaking parent, give them specific guidelines during the introduction. Remind them to pause frequently in order to keep everyone in the loop, to avoid the risk of having those who speak the same language like monopolize the conversation, okay? So it's always important to tell them, pause not only for me to interpret to this other person, but also so that that other person can, give an opinion or ask questions as well, okay?
Yes, thank you for that. And I would add, Tati, in OPI, the surprises happen too. You may hear 2 voices the whole time, but come to find out they're on speakerphone, another person chimes in. So it's really important if you have that time to clarify that up front.
Absolutely, yep.
All right, so moving on to our next protocol, direct speech or indirect speech. As you all know, interpreters should use direct speech or first person to interpret the messages into the target language. Interpreters use indirect speech in certain situations, indirect speech or third person when intervening, for example, which we'll discuss more later. But in addition to intervening, interpreters may have other situations where they need to switch to indirect speech to facilitate understanding. So this need may be slightly more frequent in remote interpreting due to some users who may be confused by the modality or not used to the modality, especially in video. So another example of this we see is for, or I'm sorry, when we see this, it could be children, it could be elderly individuals, it could depend on their mental status. So knowing upfront that you have that ability to switch to indirect speech if needed, if you sense that confusion. And this may happen, like I said, slightly more frequently in remote. Another example of switching to indirect speech that may be needed is when interpreting for multiple parties in a session. So face-to-face interpreters may use a gesture to indicate who said what, but a remote interpreter is usually better off switching to third person just due to the limitations of not being physically present. So you may need to do some reported speech. Okay. And managing challenges for turn taking. We had some of this mentioned in the chat earlier, I believe. So depending on your interpreting background, you may have heard of managing turn taking or managing the flow. No matter what it's called, the goal is the same: to be able to address parties speaking too fast, speaking over one another, or not giving you adequate time to interpret. As remote interpreters, we have to be prepared for emotional situations that make managing turns even more challenging. So this could be someone who's crying and extremely upset, shouting and anger, speakers interrupting each other, the list goes on. So if you're a video interpreter, you may still employ a gesture to request, a pause or a timeout, but you may find this could be less effective than other strategies, depending on how much visual attention you are being given as the interpreter. So signed language remote interpreters rely on service users to tap on signer's shoulder to get their attention, or for the service user to get into the signer's field of vision and redirect them by waving or pointing to the remote interpreter screen. Some alternative strategies to manage turn taking and flow: more frequent note taking, jumping in at a natural pause or when the speaker takes a breath, and just setting the tone using a calm, steady rhythm in your own interpretation can really help as well. Okay, so this is one that's similar to face-to-face intervening. A lot of people were saying earlier they think, it's about the same as face-to-face. So we just want to point out a few added scenarios that may require intervention. So if you're intervening, this means you're speaking in your own voice to address a communication concern. This protocol is very similar to face-to-face interpretations, but one scenario we want to point out, as others mentioned earlier, is technical issues. They do happen when you're working remotely, whether via video or via phone. So just remember, we can't interpret what we don't hear. Or if you're a sign language interpreter, you can't interpret what you don't see, if the video is pixelating or something like that. So never guess at what is being said. Just remember to ask for that repetition. Go ahead and intervene. Another challenge you may face when interpreting remotely is more diversity than you're used to in your working languages. So since your interpretations are now likely reaching beyond your immediate community, you'll likely start hearing new words, new accents. So take the time to clarify these terms, but also note them down so you remember them for next time. All right, next protocol we want to review is hold time. So those just starting in remote interpreting, this will be a little new for you, but as interpreters, all of us encounter some times when there's downtime between communication, and in remote interpreting, these downtimes include times that we may be asked to hold. We may be asked to stay on the line. So if you're left alone with just one user, make sure you pause your video, mute your audio to avoid the possibility of side conversations. Another approach some interpreters take is to ask that the interpreting device actually be taken out of the room while you're waiting. And the time you're able to wait will be defined by the company or organization you work for. But be proactive about communicating hold times with both parties so they know what to expect. This is a really common complaint that we hear, that the interpreter hung up when really they just reached the maximum hold time and they had to disconnect. It just wasn't clearly communicated up front. So remember to communicate this in a positive way. You know, there's a difference between saying, I can only wait 5 minutes, and the interpreter can hold up to 5 minutes. We just kindly ask that you call back. Just set that expectation up front. But it's also worth mentioning, it is extremely important to always use your best professional judgment with sensitive situations. So sometimes you may need to wait longer than is typical if getting a new interpreter would be more detrimental to the session. All right, so now we're shifting from protocols to etiquette. Professionalism matters because you are representing the profession. So you will represent all interpreters to your users, and you'll also be representative of the modality, your culture, the user's culture, in every encounter. And this is a huge responsibility. But we can ensure that we represent all of these stakeholders well by following our standards, our guidelines, and professional etiquette, which is what we'll focus on for the remainder of this presentation. So according to University of Colorado's Career Center, professional etiquette is an unwritten code of conduct regarding the interactions among the members in a business setting. When proper professional etiquette is used, all involved can feel more comfortable and things tend to flow more smoothly. So we'll briefly touch on these elements today: dress etiquette, body language, camera presence, and proper backgrounds for video interpreters, call readiness, and tone of voice. So let's look at some examples of what not to do. So interpreters need to answer calls only when they're fully ready, with their headset on, note-taking supplies ready if you need them, not chewing food or finishing a sip of water. Also be mindful of your body language. In this second image, we can see the interpreters becoming irritated and rolling her eyes at the caller. And you'll notice for body language, I didn't indicate that this is specifically for video, because actually, even if you're just interpreting over the phone and no one can see you, this body language can come out through your tone of voice. And in this last example, we see the interpreter has become so engrossed in her notes that the users can only see a head of hair. So while looking down at your notes and face-to-face is acceptable, in video interpreting, it comes across as being disengaged or distracted. So you can still look down at your notes for VRI. You can still take notes. Just be sure to look up at the camera frequently to show engagement. Okay, a few more examples of improper camera presence. So the interpreter is leaning back with a water bottle, texting, distracted on his phone. The bottom pictures have items that should not be in the view, such as the hallway, a window, and his bag. And he's also not centered in view or looking directly at the callers. But it's worth pointing out for these past two examples, don't want to throw these interpreters under the bus too much, that they are dressed professionally. So they're both using solid colors. They just need to work on a few things. And that brings us to our prepared interpreters.
Well, before you get there, Sarah, I wanted to also mention that due to the current situation, the pandemic, certain, we know that many interpreters have had to, let's say, face-to-face interpreters have started to work remotely. Many interpreters who work from language centers or call centers are now working from home. And that also, I think we all understand that maybe we don't have the best situation when working from home, or the best background, or the best camera presence, but there are many things we can do to make that a little better or appropriate.
Yes, agree. All right, so here we have all the elements of professional etiquette. As you can see, These interpreters demonstrate professional camera presence. Dress is professional with solid colors, nothing too flashy or distracting. The body language is good. They're sitting up straight, looking into the camera, smiling and welcoming. Neutral background or backdrop with no clutter, windows, or anything showing in the view that shouldn't be. And the ASL interpreter's camera view shows her entire signing space. So although we can't hear these interpreters, we can imagine that they both use a courteous tone of voice when speaking as the interpreter, and they are both ready to begin. All right, so as a conclusion, before we get into Q&A, we want to do a brief poll with all of you. So in which area covered today did you learn the most? And you can select more than one option as they apply. Give you a little time to take that poll. Let's see, there we go. Wow, they're all staying relatively even. This is interesting. Looks like just creeping over half of the participants have taken. Give people a few more moments. And again, remind you to take the poll in the actual poll pop-up rather than writing your answers in the chat, because most of them are just getting kind of lost there. Currently looks like hold time is in the lead. A lot of votes for positioning, intervening, body language, tone of voice, camera presence, background. Excellent. I know the votes are still rolling in. For me, it makes sense that hold time has gotten the most votes, it seems, since that is one thing that is pretty different in remote versus being face-to-face. Like I said, we have those downtimes when we're interpreting no matter what, but this is kind of a different ballpark, being asked to hang on the line and knowing that balance, having to learn, when to disconnect.
Okay, I think we can end the poll now. Anything else you want to comment on the poll answers, Sarah?
So it looks like we ended up with hold time being first, followed by direct versus indirect speech, closely followed by positioning, which was closely followed by intervening, body language, tone of voice, and then camera presence and background. So pretty much all of them very close. Looks like people learned multiple things in different areas, so that's good. That's what we want.
Very exciting.
Yeah, that's helpful. Excellent. Thank you, everyone.
Okay, we can end the poll now.
Oh, and it looks like I may have the option to show the poll results. I'm being asked. Let's see if I click. Okay, there we go. Share results. Yeah, so now everyone can see the results. Sorry about that. Yep, hold time is in the lead. Dress etiquette was a little lower, call readiness was a little lower. So that's good. That means that people already know how to dress professionally and already know how to be ready to answer calls. That's good. All right, excellent.
And if not, we'll have a lot more information about that in the book for sure.
Yes. So I'll go ahead and stop sharing those results and we can open it up to our question and answer time. We'll give Marjorie a moment to reset some things. I know she's been gathering your questions throughout, so maybe if nothing else, we can have her share those with us via chat.
Can you hear me now?
Yes.
Yes, perfect.
This was a headset problem, as it turned out, and I have no idea why. It should not have done that, and I apologize to you, the presenters, and all of you for that delay. I was actually trying to say that I can assure you you have more questions than you can possibly answer. So without further ado, I have to say, this is going to surprise you perhaps, but the biggest question that came up again and again and again and again is not protocols and etiquette. So we'll just ask it briefly. And it has to do with, do you recommend a particular headset? And what is Sarah's headset? Because apparently the sound is very favorable for her. And then we'll get on to the protocols and etiquette questions.
My headset brand is a Jabra. That's Jabra. I think Tati's using the same one.
And do you actually recommend that?
I do. I like this one a lot. I've used a couple different ones. I don't have too much experience with, more than probably 2 or 3 brands of headsets I've used for interpreting, but I do like this one.
Excellent. All right. Well, let's get on with the protocol questions. And this is sort of technical, but it is protocol to get started. How do you check microphone positioning? Someone is asking.
I can take that one. So I think Caroline talked a little bit about that in her webinar last week. It kind of depends on the platform you're using. So certain platforms have self-check features to check your audio, check your video before logging in, before actually accepting the calls. And if they don't have those features built in, then many times your computer settings will. So you can go to your computer settings to check your microphone, test that sound is actually being picked up, that you have the headset microphone turned on, but if there's a microphone built into the computer, that is turned off, for example. That's pretty important because if it's turned on, it will pick up on quite a bit of background noise.
And to piggyback on that, I would say that if you want to test if people could hear your breathing, try just breathing without talking and see if the bar or the test sound test bar, whatever, however that's called, depending on your computer, if it's moving, that means that they can hear you breathing. So, that way you can figure out how to adjust it.
Very interesting. Thank you. Here's a question about backdrop. Is ocean blue backdrop a must-have or optional for VRI, video remote interpreting?
I know that blue is recommended and best practice for ASL interpreters on video, and it's pretty common to see. It does look very professional. It will depend on your language company what specifically is required.
Thank you. A couple of people were asking what you meant when you referred to recorded speech.
Sorry about that. That was reported speech. So if you're switching to third person or indirect speech when there are multiple participants in the conversation, as a remote interpreter, you may have to switch to third speech and report what was said. So interpret the question, he answered, da 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 da. This is especially important in those situations that Tati mentioned, when there are multiple users maybe using the same language, they take a full conversation turn, and then you have to interpret that to the other party. Does that make sense? I hope I answered the question.
I think you answered it perfectly. Thank
Okay.
you, Sarah. What language do you prefer to use to intervene is another question.
Well, I can answer that one.
Go ahead.
Well, actually, in theory, you should be using both, not at the same time, of course. You can't do that. Even if you're a sign language interpreter, it's hard to keep up with both at the same time. But if someone is, so my two languages are English and Spanish. If I hear something in Spanish and I need to request clarification from the person speaking Spanish, my tendency is, so if I hear Spanish, my next action will be to interpret in English. But if I have a question for this person, I still need to address the person who speaks English. So I would, if I hear something in Spanish, I go in English and say, this is the interpreter speaking. I need to clarify something with, let's say, a patient or a mom, and then I go back and I say in Spanish the same thing. Habla el intérprete, this is the interpreter speaking. What do you mean with blah, blah, blah? And as soon as this person, the Spanish speaking person, is telling me the answer to that, I can start interpreting again. So it, honestly, when it comes to transparency, it's important to let both parties know that you're intervening at that moment, or at requesting clarification, however you want to call it.
Super, thanks, Tatiana. This is a question related to Sarah's hold time section. Why would an interpreter request for interpreting equipment to be removed from the room?
That's a good question. So even when you mute yourself, let's say you're an OPI interpreter, you turn the sound off. You're a VRI interpreter, you mute your audio and you pause your video. When you're in the room, as the device is in the room with the patient, there's still that opportunity to overhear things possibly, depending on the platform and the technology, or for them to try to engage you in side conversations. So having one of the users remove the device from the room until they're ready to resume the interpretation just eliminates that possibility. It's kind of the closest we can get in remote to walking out of the room as if we were an on-site interpreter.
Yeah, that was exactly what I was thinking when you were talking about that. Thanks, Sarah. To either of you, what challenges do interpreters encounter when interpreting for children? I think the protocols might change, and they specify for children who might not understand the interpreting process. I know that when they're younger than 8, especially, that can be a challenge. So yes, what protocols and etiquette might change?
I can share an example. Direct versus indirect speech is one that can be different. Typically, and this happened to me actually. I was interpreting for a physical therapy session, and the child was about 3 or 4 years old, and the physical therapist said, "Throw me the ball." Well, the child started throwing the ball at the Marty unit. So at that moment, I understood that I was not getting far with him. So I had to switch to third person and say, throw the ball to the, at that moment it was a therapist. So throw the ball at the therapist. And, I had to accommodate for that. It's very interesting. It is a little different. You have to check those things, make sure that, well, you may not know for sure that the kid understands your role, but if it's possible, you should explain it, in the beginning of the session, what you're going to be doing there in simple terms. Something like, I'm going to be helping you when you say words in your language, I will be saying the same words in this other language so that you two can communicate, you know, things like that so that they understand. But it's very interesting. But many kids are now used to remote, technology. So sometimes it's actually very easy to work with them. So it depends.
That is fascinating. Thanks, Sarah.
Mm-hmm.
This is a very timely question. Someone says, I read about some healthcare interpreters having to interpret for end users who are wearing masks, which I could well imagine would deteriorate the audio quality. So have you seen instances where the interpreter actually had to say something to address that, or is the sound quality good enough that usually it's not a problem?
I'd say this is something we're pretty used to already. You know, if it's a pre-op call or different kinds of calls, we're somewhat used to healthcare providers wearing the masks. So I personally haven't seen any instances where that's really impeded anything too much. You might have to ask them to speak up a little bit or move closer to the unit. But other than that, things tend to go pretty smoothly. I don't know if Tati has a different experience.
No, very similar. Here and there, some devices have had to be adjusted, like depending on the device, the technology. In some hospitals or in some schools, they have added additional speakers or, something that helped them, or they move to a quieter room because they know they are wearing a mask and it's hard to hear them. So it varies. But no, nothing. I think, well, in healthcare, this is very common. I can understand, it's not as common in other specialties or environments.
Thank you. That was obviously a very timely question, so helpful answers. This is an interesting question. So should we ask, is there anybody else in the room?
You definitely can. So if there's time for that and, it's not an emergency, you don't have to just get started with things, have a script ready. Okay, the interpreter's ready to begin. May I ask before we get started, are there any other parties present in the room? And they say, oh yes, actually, the dad is right over here. He steps in. Okay, just to have in mind who's all in the room. Mm-hmm.
Cool. Do you have a script for how to remind participants to pause for the interpreter when doing consecutive?
Yes, I think either one can answer. We do. I like to not only remind them to pause often or frequently, but to tell them why. Otherwise, they won't stop doing it, or they won't necessarily understand why you're asking, over and over again to pause often. So I like to say something like, please pause often so that I can interpret everything completely and accurately. Or, I've heard many versions. Maybe please pause so that I can convey the message completely, or please pause so that I can, there are many variations of that, but mainly telling them why you need them to pause. Otherwise, a lot of the information can get lost.
And I would say, as a remote interpreter, if you're noticing that that's a trend with your users, maybe giving it a little extra emphasis in your briefing, in the introduction, so really emphasizing that part. Please remember to pause so that I may interpret your message accurately. Pause often, speak slowly, whatever points that you realize may be a struggle in your interpretations, you can emphasize those in the briefing.
Super practical advice. This will be our last question. If you are asked to do an interpretation with ample time, is it appropriate to ask who the participants are, their roles, and the topic? We would have hoped they would have that information, but obviously not always.
Yeah, I mean, I would advise keep it as succinct as you can. Something that I've noticed with remote, you know, we don't see everything that happens before, so we know that the users may be rushing to do things, get from one patient to the next, or from one conference to the next, or whatever the case may be. So they may sometimes be a little rushed. So try to keep your requests like that succinct and brief, and just be able to move things along efficiently while still gathering the information that you need.
Well, I'm afraid I'm sad to tell you that and to tell everyone that we have no more time for questions. This has been an extraordinarily rich and, as I said, substantive discussion. We are, as we know from chat, as we know from the plenitude of questions that we couldn't answer, it's been a very, very appreciated one as well. Tatiana and Sarah have kindly agreed to share the PDF of the PowerPoint presentation. So you will, within 24 hours, get a link to the recording and to the PowerPoint if you've attended this webinar. And in the meantime, when we've sadly bid farewell to Tatiana and Sarah, I will remain in case there are administrative questions or questions about cross-cultural communications. But first, with huge thanks, all our thanks and warmest thanks to Tatiana and Sarah for the wonderful presentation. Thanks so much.
It's been an honor for us. Thank you for having us, and we hope you like the book.
Yes,
we are really excited about it.
Later this year, we will be publishing this amazing textbook, The Remote Interpreter. So we can't wait to see it published. Thanks again. Have a wonderful day, Tatiana and Sarah.
Thank you, everyone.
Thank you. Goodbye.
Bye.